Welcome to Labcast, a podcast about the medical laboratory science profession, brought to you by MedLab Convo. To get notified once we drop an episode, you can do well to subscribe to all our social media platforms at MedLab Convo. For questions, feedbacks, and shoutouts, you can do well to send a mail to at medlabconvolabcast@gmail.com. Thank you for listening.
You just got inducted into the MLS profession. Does that mean you're a good lab scientist, or does your real education start now? Or maybe you're experienced in your field, but you don't have an advanced degree. Are you behind? Are you less credible? Certificates are valuable, but they are only part of the equation. True excellence in medical laboratory science comes from building real competence. And in today's episode of Labcast, we are going to be diving into the balance between earning certificates and developing the practical expertise that truly defines a great laboratory professional. I'm your host, Chinelo Anwudiaga, and with me is my co-host.
Hello, I am Ubani Confidence Mesoma. Welcome to yet another episode.
All right, and joining us today is a very special guest. He is a lecturer, a certified medical laboratory scientist with a master's degree in histopathology and also currently pursuing his PhD. We are talking about Mr. Amigun Ajibola Emmanuel. You're highly welcome, sir.
Thank you so much for having me. I'm glad to be here.
All right, thank you very much, sir. So together we're going to be examining what really makes a good medical laboratory scientist. So I want you guys to stick around as we explore this. All right, so I'll be starting with the big question. Sir, in your experience, which one actually matters more when someone steps into a real medical laboratory setting? Is it having the certificate or having genuine competence?
Oh, okay. So at the end of the day, I'm going to start by saying having this certificate is actually a major thing that you have to have as a medical lab scientist. But at the end of the day, you need both the certificate and also the experience to really, perform and deliver your duty. And that's why I'm going to go by this particular say that says, okay, fine, the certificate will actually open doors for you. But what actually keeps you in that space to perform at that high level is actually the experience you have, the ability to be able to perform at that particular peak where you can actually deliver and actually, give the best to your patient. It's actually about, you delivering your service as a medical lab scientist, as a med practitioner. You are working with other, health practitioners in order to give service to render services to patients and all that. So in real sense, it's actually not about the certificate that keeps you there. It is actually what you can deliver, what you can actually give to this to the medical teams and actually perform. It is that particular experience, ability to perform that can actually keep you there, not the certificate alone. But then for job opportunity, for you to be able to get a job, you need a certificate at first, together with the licensing and all that to get into the profession. Into the bench work aspect of working. Thank you.
100%. I agree with you, Mr. Ajibola. Also, since we're talking about competence versus certificate, please could you give us a quick rundown of your experience so far in medical laboratory science? How did you get to the point that you are now?
In 2010, I started a program called Medical Laboratory Technician, and that lasted for 3 years. It's a diploma program, which is more or less like the baseline. Apart from the fact that they counsel medical lab assistants, medical lab technicians are, personnel who assist scientists in the laboratory to deliver their service. So that program, I ran it for 3 years, and I worked for a couple of years before I went back to school to pursue my, BMLS, which is the medical laboratory science degree. After completing that, I was able to, at Lee City University in Ibadan, I had my internship done at University College Hospital, which is UCH in Ibadan. And after that, I also began my MSc in MLS Histopathology major in 2023, and I finished my MSc in the year 2025. Immediately, I was given a scholarship to commence my PhD and have started the PhD. So that's my journey, and that's how I found myself in the profession of medical laboratory science. But coupled with that, the fact that I have the intensive training at UCH together with the academic training back in uni, I think both actually helped me in getting into the real a word, and that was actually what prepared me and what took me into practicing at the moment with the State University Teaching Hospital at the anatomy pathology department, also known as histopathology. As a full-time staff thing, I can also tell you that I also lecture as an adjunct lecturer at VCT here in Ibadan, coupled with the fact that I'm also an adjunct lecturer too as Ekiti State University at Ekiti. I think that's a little background run I can actually put on the head. Thank you very much for asking.
Sir, that background was anything but little. Some of us are yet to scratch the surface. But anyway, the question was a follow up to this. In your years of experience, have you ever observed anyone that has good qualifications, various certificates, has all the certificates, but still struggles with bench work? Or the opposite, that was someone that has little or no certification, but is good with the practical aspect of our work?
Okay, well, I'm going to address that question carefully because I know I've worked with a very good set of people before, starting from me working at Redeemer University of the Osun State, which was my first technician job, and then to UCH in Ibadan internship here, then currently at Ekiti State, and also other few places that I've had the opportunity of working. I think I currently I know of people who may not have that particular ability to. I think I know they can actually do better, like really giving better than what they are currently giving. And may not be able to narrow it to the particular institution. But then I've had opportunities before, and I've also seen people have been given little, and then at the end of the day, they perform more than what they should be doing. I've seen technicians where they can actually do all sort of things, and it has really, as a result of the experience they've been able to acquire with the superior they work with, and that's what leads to me saying okay, it is actually not about the certification only. It is actually the experience and the ability to dedicate yourself to really wanting to perform. And that's why sometimes talent is actually not so enough. You really need to really give your best and push yourself a little bit harder so that you can get the best out. And that's why sometimes I tell people the way our nature is built, we are more or less like an elastic. So at the end of the day, if you don't push yourself so hard, you may not actually be able to perform at your, your highest level of performance. So I've seen technicians who do a lot of jobs. I'm not saying they are not, of course, the services they render, we know what they should be doing in the laboratory in terms of the preparing slides or preparing the samples for scientists to really work on. But then you can actually see even outside the scope of their responsibility, their scope of work, they can actually do better than that. So I've seen technicians who do better than that. And I also have had the opportunity of seeing scientists who are doing little and not doing enough than they should. I mean, that they should be doing, especially when it comes to hands-on experience on bench, what they should be doing on bench, and it's also more importantly when it comes to training students who get posted to their facilities for training and all that. So I think I've had the opportunity of witnessing both sides. Thank you.
All right, thank you very much, sir. From what you said, I noticed that there are some things that you've seen that separated a good med lab scientist, a good one, irrespective of certification, from someone who is average. So could you possibly outline some of these competencies that you think are non-negotiable that separates a good medical laboratory scientist from an average one, things that certificates do not guarantee?
Okay, thank you very much for asking me. I think if there's anything I want to really like and adore most about medical lab science since I started practicing, even at technician level to being a scientist now, it has to be the level at which you actually discharge your duty. The ability to really carry out your tests, then also interpret it, and also troubleshoot your machines when you have issues in the laboratory. I've worked at places where you see people buying, reagents. For example, let me start with an example. I've once worked at a particular laboratory where what they do is that they buy commercially prepared reagents for H&E, staining, and all that. When I got there, I told them, okay, fine, we can't keep doing this, considering the fact that all these, commercially prepared reagents are actually things that are not that necessarily reliable. WHO says for your H&E staining. I'm just citing an example. That's my field. For your H&E staining, you're expected to use your stain for about, I think, 400 or 500 slides. Then after that, you are meant to change it. You tend to realize that these commercially prepared stains, they don't last up to 200, and then they take longer time to stain your slide. The potency wears off, and you won't be able to even get your best result when you stain with H&E. But then I told them, okay, fine. I've I've been somewhere before where we produce this agent by ourselves. We produce this thing by ourselves. And at the end of the day, it gives us better results, better staining quality, and we get better results, and it stays longer. You don't necessarily have to say to stain your, for your co-hematosine or radish hematologist stain for 5 or 10 minutes, or you don't have to stain for 15 minutes, sorry, or probably 25 minutes because the potency is gone. You have to stain for 5 minutes, 10 minutes to have your result. So as a medical laboratory scientist, if you don't have the experience to really do all these things, then you may not actually be able to perform. And that's why I say people can actually do better, but they are not actually doing better than they should do. People just get the certificate, they don't have the experience they need to perform, not because they didn't really impact it on them as training. I don't want to blame the scientists who train them during a hospital posting or private internship days. People really do not come for internship, and people don't even go for their clinic, which could be as a result of that. Maybe that's why they are not getting it. But then when it comes to your ethics too, I think the ethics of the profession is another aspect that I would like to dive into. People really need to understand that, yes, for us to really deliver, the way you actually carry yourself really matters. And that's why sometimes I tell people that, okay, fine, the way you dictate this discipline, you see a lot of people coming into the profession, especially these days, the new scientists that we're having on board, they call them Gen Z scientists and all that. Many of them don't dress properly. Many of them cannot even, do what's required of them properly. Many of them cannot even work, under lesser or probably little or no supervision because you are not going to be so sure of what they can do. I'm not trying to tarnish or probably talk them down, but I think people can actually deliver better if they had gotten the right training, then also pay attention and learn very well. So I've spoken about the ethics of the profession in terms of the way you carry yourself, knowing your don'ts and your don'ts and the things you can actually do and the things you should not do. Yes. So after that, then I also need to talk about the way you carry yourself, just like I said. Imagine you are given a particular samples to run, maybe your chemistry and analysis, maybe your EEC creatinine or LFT. As a scientist, when you have a sample, the age matters, then coupled with the fact that you know your expected reference range and the result you should be having. When the result goes bad, you should be able to know what to do. By running your controls, you can simply detect, okay, fine, if the machine is actually malfunctioning, then before you release your result out. So in case you don't do all these necessary things that you should have been equipped with during your internship level and clinical days, that you should be equipped with on how to really, troubleshoot your machine or know if the result is actually wrong. If you don't get all these training, it's going to be really difficult for you to not put yourself into that shame. And that's why I said certificate alone cannot really do. If you don't know how to do all these things, you're just going to look like a fool to other, physicians or probably health practitioners who you are working with in the particular hospitals. Let's say, for example, if you send a particular SARS sample, due to the fact that your machine went bad, then you use a wrong result, a result that is actually not so accurate enough. Then at the end of the day, you realize that physicians are just going to mock you, especially when they go to other lab and they try to run another test and they are getting another result. So I'm saying in research, apart from the fact that we're getting the certificate, I think we need adequate experience. Number one, know your stuff, then more importantly, carry yourself well, and also try to develop yourself more. Far better than what you learn in school. You should read more, then also create time to also learn from the superiors. I think I should stop from there.
All right, sir. Thank you very much. There were a whole lot of things you pointed out that I could totally relate to. The aspect of you having all the certificates and not being able to do what you're supposed to do and being an object of mockery in the presence of other physicians and other scientists. And also the fact that not everybody goes for internship, not everybody goes for posting. So the whole system does not really tell does not really certify that you are a great scientist. I could really relate to that. Thank you very much. So my next question would be, how much value how much value of a medical laboratory scientist do you think comes from the whole theoretical knowledge, from what we learn in school, when compared with the hands-on experience we have when we're actually working as laboratory scientists?
I think I will address that question from a perspective of me saying, uh, I think the theoretical aspect plays a major role. At the end of the day, the training we have, we have been exposed to, especially during our days. Okay, fine. Take for example the 200 level where you do physiology, BCH, and all that. You need these theoretical aspects to really study human physiology. And this actually plays a major role on what you should be expecting. Your anatomy during your 200 level, this will play a major role. Your BCH two plays a major role. So at the end of the day, all these courses, the theoretical aspect plays a major role and helps us to really, narrowing our, I don't know, I think there's a better way to put it. All these theoretical aspects actually helps us to really interpreting and gets us to relating them with the practical aspect, which is us carrying out our analysis on patients. What am I trying to say? So at the end of the day, you practicalize, you do a lot of things on bench, but then if you actually don't study the core theoretical aspects, you are still going to, fail up. And that's why I said the certification is there, the theoretical aspect in school is there, and that's why the practical aspect should play a major role. And that's why I think the training of medical science from I think the last since the establishment of that course, I don't know the history, but I know a lot of people did something related to, they call it associate at some point in time, where they spend more days in the hospital and they write exam and all that. So at the end of the day, you still come back to you combining both theoretical aspects together with practical. So you can't rule out the theoretical aspect because it actually needs you to really function and perform. You can't be demonstrating and carrying out your analysis without knowing the true basic, and without you having an understanding to what you are really working on. If you give me a blood sample now and I actually don't know the formation of the blood in the body, then that simply means I don't know what I'm doing. So if you are telling me as an hematologist, and okay, fine, you know how to carry out your PCV, you don't even know where the blood formation is coming from, and that's a total follow-up. If you are telling me to analyze my WBC or maybe do my blood count, then I actually don't know what white blood cell counts are. I really can't say if you can't really, you won't know how to really troubleshoot or probably balance your practice on bench. So both work in hand. You need the theoretical aspect to give you that solid foundation to equip you with the theoretical knowledge that will give you the physiology, of the human body, and that is what you are going to be practicalizing and you'll be demonstrating on bench. So you need both to work in hand. At the end of the day, you can't rule out one. The theoretical aspect plays a major role too.
Thank you very much for your responses. The fact that you connected theoretical knowledge to the real world experiences we have. Now, not just me, I and every other student listening, we know that our theoretical knowledge is not just a waste, because most times you might be there and you'll be like, let me just leave it. When I get to the lab, I'll learn it. When I get to the lab, I'll learn it. And then we end up just reading to pass exams instead of reading to practice. Thank you very much. But then my next question will be, why do you think that the medical laboratory field has become so obsessed with certificates? We are more obsessed with certificates and credentials and degrees, even at the expense of actual skill development, even at the expense of gaining actual experience. Why do you think that is the case?
Thank you so much, MLS Miller, if I get that correctly. I
Yes,
think at the
sir.
end of yeah, thank you. I think at the end of the day, we are just here trying to give our best. So I'm going to take that question very carefully. You said, why do you asked that why do people choose certificates of probably more than competence? In recent, in my own opinion, I think the first reason is because number one, people want to get a job. Without the certificate, you can't get a job. People want to hence they want to actually hands. They want to start, okay, fine, living. People want to live. But then at the end of the day, if you don't have the certificate, you can't get a job. If you don't have the license, you can't practice. So people want to start earning. People want to get a job. So for job opportunity, I think that's why. Then at the end of the day, too, the job market pressure is there. Why people study other courses that are not cake in the market? Either you like it or not. Medical lab science together with nurses, doctors, and all these medical courses will always be a not cake in the labor market. So that's why people chase that certificate because they know once they get it, they're telling us they will get a job. But in real sense too, I think societal expectations too is another part to it because people, okay, fine. Oh, I just want to make people, oh, okay, fine. There's some expectations about me. Okay, fine. This is what I could do. This is what I should do. And there are expectations upon me. Okay, fine. People just want to do it. Fine, let me just get it done for that societal expectation. So I think that's another reason to read too. That being said, I think there's so many problems that I think we really need to address. And what will really help us to really prevent all these things? We need number one thing is that we need the mentorship. There's a lot of thing that medical lab is actually not because you just dabble into and you just want to go straight and you just want to get to that peak. You need someone to mentor you. If you have someone to mentor you, after having the certificates, then you can actually become better. That's the logic to it. I never knew I was going to become an histopathologist. No, I never thought I would become an histoscientist. No, I've had it in my mind that I was going to do medical microbiology. Yes, that has always been my dream during technicians. I was a technician for how many years? I practiced for 7 years before I went into going back to school to go and study MLS. Have had a basic knowledge as a technician working with the scientists on hematology, medical micro, then chem part, apart from the only one particular aspect, which was what's it called, histopathology. But at the end of the day, I had another mentor who was mentoring me and all that. So I think people chase certificate, just like you said. I've given you reasons why people chase societal expectations for job opportunity. Then people want to feel among sometimes too. Then at the end of the day, I've seen people who want to get into medicine who couldn't get into medicine and decide to just go into MLS. At the end of the day, just want to get certificate and just leave. But then if you have a very good mentor, it helps you to prevent all these particular prayer and help you to really, reaffirm your foot on a particular solid ground and help you to knowing what you need to do and what you need to acquire.
All right, thank you very much, Mr. Ajibola. You said something about mentorship, which is something that is very, very important. Mentorship is a platform to consistently go in the right direction, to learn from the experiences and mistakes of others and not make the same mistakes. And on that note, I would like to remind everyone listening that MedLab Convo has a career mentorship program. So do well to key in. For those who have registered, do well to take it seriously, make use of this opportunity you have so you don't end up making the mistakes that others have made. All right, so I have a really interesting question for you. Let's paint a scenario where you're a lab manager or you are to employ a scientist for a laboratory. What exactly would you look for when hiring or promoting? Or on a general note, from a lab manager or a pathologist perspective, what exactly would they really look out for when hiring or promoting a medlab scientist? Would they look at the credentials, the certificates, or they will look at proven competence?
Okay, so you've been able to put questions at me at once, but then I will address them one after the other. I'll be addressing the first one by hiring. You ask about what will make me to hire. Is it the certificate or the competence or probably the experience or probably when it comes to promotion level? So let me address hiring. And I'm going to place that particular experience, answer to the experience I've had. I've been so lucky that I've attended like few interviews before, not many. I think I've attended maybe like three or two. Yeah, when I say strong interviews, different from the number one that probably most time I get recommended, most time I get, I get invited. But at the end of the day, we still do interview. But then I went for an interview in Lagos. It was basically, I mean, they were not doing the general laboratory, it was an ISTO laboratory. The mother company was in Lagos. I mean, no, in USA, according to them. So they needed to establish a branch in Nigeria. And they interviewed like people before I came. I told them I won't be available for another, let's say, 2 weeks. They waited till I arrived. And when I got there, they interviewed me. It wasn't based on the certificate. It was based on the experience. They kept asking questions about how will you troubleshoot a particular slide that looks opaque when you have your slide. For those who major in this, so you can actually know, okay, fine, these are major issues you may have while processing your slide. If you do failure to really dehydrate your tissue, completely, then you will be having some opaque on your slide, and more importantly, your tissue won't come out well. So when they put that question to me, I already knew that was what the woman was trying to talk about. So it was not about majorly about what I could do, and that was why I was going to get the job. Though I rejected the offer at the end of the day. They also took me to their laboratory and they gave me the autostainer machine. They told me to operate it. They took me to the microtome machine. They told me to operate it and all that. We didn't have autostainer at usage. I mean, of course, we stain manually because the machine is bad. But then when it comes to the microtome machine, I remember Mr. Lale, who happens to be my Oga, who trained me on how to, we worked together. He was the one who trained me. And I think to a certain degree, I think I will forever be grateful to him. So in real sense, when handling the microtome machine, I know what I can actually do. So on the day of interview, they didn't ask me all those questions or probably give me an answer booklet to start writing. It was strictly what I could perform on the bench. If I'm going to employ you, I won't be employing you based on your certificates you are bringing. I'll be employing you based on what you can do. There's some technical questions I will be giving to you and I will be putting to you. So if you can deliver and you can give it to me the way I want it, they'll probably know you're not competent enough. So if you will be asked, and if you are asking me, what will be the criteria for me to employ new scientists into my laboratory? It will be basically, it's going to be majorly on the experience you have. And I will be testing your ability to really think. Your critical thinking actually matters a lot. It's not about certificate alone. I've seen people who go to school who don't even know how to manage work. I've seen interns posted to my laboratory before who didn't know how to really stay in H&E. I'm sorry to say this. The person trained from one private university. I won't mention the name. And when the person got to my lab, they employed the person, and I said, okay, fine, staying in Asia and all that. They already employed. The management are the one employing. They don't most time involve the scientists to the interview and all that because of the politics and all that. I pray at some point in time we have the grant to really be the key player when it comes to decision making at the hospital. Maybe we'll be able to correct a lot of things. But then at the moment, they brought them in fine. So I told this guy, okay, if I stay in Asia, at least if you are a medical scientist, you major in these two. During your 400 level, 400 level, you're expected to do Asia in your first professional exam. The 500 level, if you major in these two, those are the things you should do when you go for your special posting, specialty posting. At the end of the day, I realized this guy was trying to differentiate in one semester that for and left it there for 5 minutes. This is something you should do briefly and right, so that your evacuation thing doesn't wash up. So it is actually going to be, and I was trying to, okay, fine, you are bad at this thing, you don't know anything. So I try to train, and I think I love it when I try to train people. I know that I've trained a lot of students in the last 2 years, and I have some products I can actually badge or probably recommend for jobs. And that's because I know what they were as when I met them and the impact I've been able to impact, the knowledge I've been able to impact in them. So I won't castigate you or probably send you away, but if you're ready to learn, I'll be willing to teach you. And that's why I tell my students, come during my core duty, come and learn. Come during after I work hour, then let's work together. I don't mind organizing online classes and all that. So in recent, it's actually the experience that really matters, not the certificate. Of course, I will look the certificate. I will be so sure that you have your registration done with MLSCM. As an intern, I expect you to have your provisional license. As a full-time staff that is coming to get a job with me, you should have your license updated. As long as you have those two, which are not, they are fundamental reasons why I will take you in, according to what the MLSCM wants. But as me, as the manager of that particular unit or the laboratory, I want to test your experience. I really want to know the stuff you have. I want to know that when I leave, I'm not around, you can actually deliver. So when it comes to promotion too, I think I should quickly address how we hire people that comes to my lab for job. When it comes to promotion, yes, you may have people who are competent enough in terms of certifications that they've worked for years. I've once worked with one guy who said, Dr. Ajay. He said I see people who do take appraisal form to him for promotion, and he keeps saying you can't run 1 year or 2 years and not have a particular additional course being done, or probably you need to go ahead and acquire more knowledge. So Oga said, for every single year, make sure you develop yourself. There's a lot of things you can actually do. There's the mental health sciences, there's CPT program you can actually do, continuous in your what's it called? CPD program you can do to to get yourself trained more, you enhance in knowledge and all that. There are conferences you should attend, seminars and all that. There's even a very, very free one, MedLab Africa, that you go to, you see new innovations and all that. If I am your boss and I'm the person who is supposed to recommend you for promotion, and I'm going to be the one to appraise you. If you stay with me for 1 year, 2 years, and you didn't develop yourself, I will be disappointed because I think you don't want to become better. So it is not going to be about certificates. Dr. Jai said the CMD I was referring to when I said I used to add one gap. He said for every year you develop yourself. If you don't do that, you're just repeating the same year without adding any knowledge to yourself. So I think if I am the boss who is supposed to recommend someone for promotion, I will probably be asking you, not like I will be asking you, what have you done over the years to really get yourself better? And that's why we need to, the training of medical lab science, encourage train and retraining of staff. I think I've been able to answer that.
Mr. Jibola, that's a very important consideration, and I'm glad that you talked about it, because I was going to ask you a question about continuous professional development, CPDs, and how it can help young medical laboratory scientists build competence. Also, while you were speaking, you talked about specializing while in school, specialties. I've observed that more recently, some schools are doing away with that method of training. They are now allowing students to just have a broader sense of what the profession is about up to their final year, and then they can just choose a particular area specifically for their project. I don't know if it's a trend, or I don't know if there's been a change in the curriculum. If you'd want to comment briefly on that, is it more helpful for students to specialize, or do you think it's better for the sake of competence for them to just do everything basically?
Okay, I think I'll address that particular question based on the experience and the knowledge that I have at the moment. Except the MLS CN will change the curriculum tomorrow, which as of this moment, I don't know if they've changed that. So you are expected to start your program 300 level or introduction to medical lab, you do all that into your 300, 200 level, 300 level, then 400 level. You at the end of the day will still be doing the general course. For your 200 level, 300 level, 400 level, you are supposed to be equipped with the general knowledge of medical lab science. And that's why you are a scientist to all. You're not specializing in all those years. And that's why your 200 level, I think if you're in medical lab now, medical lab science is in 200 level. Yeah, I think if I'm right. Some people do it in 300 level, but some do it in 200 level. So that means from your 200 level days, 300 level days, you are not supposed to be doing borrow courses anymore in your 300 level and 400 level days. You should be specializing, focusing on the major core laboratory science training, and that's the beauty of it. That simply means I should have the basic. As I am now, I think I will perform beautifully in the medical microbiology department. I also do well in hematology. I will also try my best in ChemPass, not only histo. So I'm not an histo scientist like that. As a matter of fact, the school I finished from, most schools, not even my school alone, most schools don't put specialties on your certificates because they expect you to be a generalist. But the training has been able to, the way they design in the MLSN design it, okay, fine, you major in your 500 level. You are only majoring for 1 year. That doesn't mean you don't have the general knowledge in hematology, medical micro, ChemPass, the four major aspects of medical lab science. I know you are doing virology, and I also know some units who are also doing molecular biology. I think something related to that. But then the most popular one that we all are all exposed to is chemical parts, medical micro, hematology, and histo. When I decided to choose histo, I wouldn't have even chosen histo to start with. No. I would have probably decided to choose medical micro, just like I rightly mentioned earlier. But then when I got to UCH and I saw a particular science is Mr. Lale, who brought out the cryostat microton and the machine and just demonstrated the process section. He told us to go and buy rats and all that. So we bought rats, we demonstrated it, and we carry out. Then we had a particular section done with the cryostat machine. It was so beautiful because it was like something I have not had an experience before. I know how they do PCV, do flow count and all that as a technician. I know how they do blood culture and all that, all those culture in micro and how I have all those basic experience as a technician for good 7, 8 years. But someone brought something new and something very unique to me. Using a machine, we got the rat, we harvested the organ, we sacrificed the rat, we harvested the organ. With the cryostat machine, we were able to process that tissue sample. I mean, we also cut that same day, we stained, and we had the section viewed under the microscope. I said, oh, this is very beautiful. This is a unique aspect. And that was the day I made the decision that I would be specializing in this too. So I think I owe him that. I owe Mr. Lalaye that he works at QC, he's scientist there. What am I saying is that mentorship plays a major role of where and how you specialize. Experience you have to plays a major role. If I had not gone to UCH, maybe I had gone to Ade or Yo, they don't have this too, or probably ABC. There's another hospital here in the they call it ABC. They don't have all that. Facility without you wouldn't have exposed me to that kind of experience. And that would probably be a bad thing for me. And that's why I encourage some HODs. I've had an experience with an HOD sometimes I won't be mentioning to this. HODs don't post their students to all those for general laboratory. I don't like it when people post students to centers who are with only hematology chem part and medical micro. Let them be exposed to others. Let them be exposed to ISTO at least once, probably 3 times. Or I mean, there are a lot of clinical posting you will do. Ensure that you post them. Let them go and experience that particular other aspect that is not common to everywhere. Post them there to have that experience. So let me not divert from the question you asked me. You asked if it is actually a good point that we are specializing. What does specializing actually makes you do? It makes you become an expert in that field, and that's what happens in the Western region. I know a lot of people there. I have a friend who at some point in time I met during my internship here. She trained in UK. She was a medical, what's it called, medical microbiologist. She said that was what she went to study in UK and all that. I think most countries like that allows you to study hematology from beginning to the end, not generalist. But then the advantage of it is that it makes you to be an expert in that field. Becoming an expert is the major reason why you are majoring. It simply means when they wake you up at night, you should be able to actually carry out a particular analysis and actually demonstrate your, or whatever analysis they give to you, whatever test they give to you, they expect you to be able to demonstrate it, have that particular critical thinking, interpret your results, and know what you are doing. Then have the basic knowledge, the fundamental knowledge, and all the necessary skills that will actually make you to really be competent in carry out that particular test in a very efficient and a very accurate way. That's why specializing is important. It comes with a little bit of disadvantage for countries who don't have the general broad knowledge. But for us in Nigeria, if you study a course for 3 years, 200 level, 300 level, 400 level, that's a very detailed years for you to have benefited from other aspects. I don't think Nigeria system, the way the curriculum is being built, I don't think it has any disadvantage, no disadvantage compared to other countries. And I think we should be happy that we are being trained in Nigeria. The friend I was referring to who came from UK came to come and gain a broad knowledge, and that's why I met her in UCH. And when she came to UCH, she did 6 months posting, going around the whole department, because all the laboratories she has been able to, that she practiced in UK, she was only chance to work in medical micro. She needed an experience to get an NGO job, according to her. So you needed to learn hematology, histo, and also and also chemical pathology. So she came to Nigeria. I think she, in another country, working country, she will be paying a particular huge amount of money to get that done. But then she got it done. I don't know how much she paid at UCH, but then she needed that knowledge and she came for it. So we should be thankful that we have that curriculum, the training of MLSCN, and the MLSCN actually give us to us that we're actually enjoying today. We are generalists, and that's why we are scientists. That's why when you go for internship, they don't allow you to do your internship in your unit alone. When you study it carefully, you start from most institutions will tell you to start from your major, that you majored in 500 level. Your majoring that you're specializing is for 1 single year, that makes you to become an expert, that makes you to become a guru in that particular field. But when you are doing your internship, you rotate all those labs, 3 months, 2 months, 2 months, 2 months, 2 months in what's it called? In other specialties. That means whatever theoretical aspect you've been able to learn, you need to know how to carry out your EUC creatinine as a scientist, as an ISO scientist. You need to know how to carry out your blood count. You need to know how to read your blood stream. You need to know how to do your sugar test. You need to know how to carry out your LFT and all that. You also need to go to medical to micro and do your normal your plate reading. Then more importantly, do your MCS and also do your urine culture and all that. So it is actually beautiful. I think I love the curriculum. I love the way it has actually been set up. I think we are lucky to have that particular curriculum, and it's actually a very good one. But majoring in 500 level for that 1 year, I don't think it comes with any disadvantage. It only makes you an expert in that field, and I think it's the best one.
Very eye-opening response, Mr. Ajibola. Thank you so much. So we've said a lot of things during the course of this conversation, things that are insightful and interesting, really. Some things that I'm just hearing for the first time, especially the part of appreciating, the fact that we are trained in Nigeria and we have access to some resources that we could use better. But if there is one thing I've been able to take away from this conversation is the fact that in real life setting, competence certificates alone is not enough. So while your certificates might be enough to get you through the door or to grant you access, it's your competence that will secure your place and sustain your success in the lab, like Mr. Ajibola have extensively explained to us. We'll be ending the episode now, but I would like to ask her if you have any other thing to add, maybe something that you want people listening to this episode right now to take home, just briefly in maybe 2 sentences.
Okay, thank you for your words and for all those things you said. I think if there's one thing I think I want people to take home, especially for students who are going to be listening to this, who are currently listening, I think I need people to understand that you are not doing anybody a favor for giving your 100% to work. You're actually doing yourself a very good favor, because when you know what you are doing, you know your stuff. It's actually, it makes you sellable. When I say sellable, people respect you more. People don't only respect you, people actually want to have you on. People want to have you at their company. People ask you for job. I've experienced that before, and I'm going to say it again. You need to know your stuff and learn it well. Go for clinical posting when you are required to. All these things matters. I tell people an experience you have today that you come to my training, to my center, you may not have that particular opportunity to see that kind of samples again. And that's the beauty of it. So be there at all costs. Be there at when you are required to be there. Even on days that you are not supposed to be there, on call days, probably weekend, that you have a scientist who is willing to teach. I think you should also go there. Then I also think I would like to also or give a little, I don't want to say advice. I think I will implore my other colleagues who wants to be trainers, who are the one training students, maybe on clinical posting or inside classroom. I think we also can do better by ensuring that this student gets the best. It makes no sense if they don't get the best from us. And more importantly, the future that we think, okay, fine, we have, the present MLS that we have today, if we don't build that particular solid foundation for those that are coming, we may not have a future to actually hand over the profession to. At the end of the day, we need to keep the flag flying, and we need the profession to keep getting better, and we need more competent people. But whatever you do as a student, as a staff, as a trainer, as an HOD, as an OGA, as someone who is in charge of training, or probably the student that you may be, please give your best, and then let your best speak for you. Because at the end of the day, whatever we do, as a scientist, your ability to perform at high level, your competence, then or the accuracy in your work convention, all that really plays a major role to helping the patients you are attending to. It actually helps them in getting better. But when you made a mistake and maybe something goes wrong, you give a particular bad result that kills the patient today, the particular service you render will stay there for life. I keep telling people that the service we render to people stays. Anybody can render the service you are rendering to people, but whatever people get and benefits from the service you render to them is what they take home. And for life, they will remember it. Nobody, still remember how good you are, what good you've done if you are doing the right thing. But one day when you do the bad thing, that's what people will probably lay more emphasis on, and that can actually stay for many years. Thank you.
Very well, then that brings us to the end of this episode. It's been a really interesting conversation, and if you're a medical laboratory science student or young professional, I hope this sparks something in you. There is no room for mediocrity. As much as certificates are important, you have to keep building your competence, because at the end of the day, that's what separates you from an average person, right? So if you have any questions, any comments, suggestions, feel free to reach us via email at medlabconvo@gmail.com. And if you're not following us on social media yet, you are wrong. It's Medlab Convo across board. We can't wait to hear from you. And until the next episode, bye.